Good afternoon, everyone. It is a great pleasure and honor to be here, and I want to add my voice to Carolyn's in any program that honors John Eisenberg is good by me because, like her, I was a trainee of his and feel fortunate to count myself among the big group of people, both students, and were inspired by him. So when we were talking about this panel several weeks ago, Farzad pointed out something important, and that is that probably the single biggest difference between the way the world is now and the way the world was when this first and even second report were issued is this: information technology. Yeah, we've got new machines in the hospital and new things that burr and whiz and go bang in the night, but our lives have been transformed by information technology. And so we're going to talk a little bit about the implications of that for this patient safety movement. The Planning Committee, in its infinite wisdom, if you think about this program, the panels this morning and the first panel were kind of reviewing the history of the report and its impact. And the last panel and this one are a little more focused on the future and where we go. I would point out that when To Err Is Human was published, the iPhone was still 7 years away from being invented, that you would not have known the word Android unless you were a science fiction fan, that Epic meant, I don't know, Ben-Hur or Cleopatra or maybe Star Wars. And that if your CIO, if you had a CIO, came and told you they were going to put your data in the cloud, you would have carted him off someplace. So if you think about how much has changed in the world of technology, our information technology is now powerful, ubiquitous, usable by lay people, interconnected, and more recently, mobile. And so it's worth just thinking about the fact that almost everything that was the underlying premise of how people communicated with each other, about what data was available and how it could be accessed, analyzed, and shared with others, has really been revolutionized since this report was written. In some ways, less so in healthcare than in other sectors, but increasingly and inevitably in healthcare as well. So, how many of you know the term SOAP notes? SOAP notes. Anybody know who invented SOAP notes? Larry Weed. So Larry Weed taught several generations of doctors how to be doctors. And I can't help but be reminded as we talk about your physician knowing his or her stuff or the patient-physician relationship. Larry Weed and his son wrote a recent book called Medicine in Denial, which for me captures the paradox that we're in right now. He said, any system of care that depends on the personal knowledge and analytic capabilities of physicians cannot be trusted. That's the guy who taught doctors how to be doctors, right? So the last panel brought you a view of perspectives from outside the healthcare industry. This panel will bring you 3 perspectives from people who are deeply knowledgeable about healthcare, but who will bring to this safety and quality discussion a lens that we haven't talked about so much already today, though it's been alluded to. So without further ado, I won't give you the whole bios because, as Carolyn said, we'd be here till tomorrow. Maureen Bisignano is the president and CEO of the Institute for Healthcare Improvement and has been there for more years than she would care to recall. The IHI, on whose board I'm privileged to serve, has taught me and all of us a lot about lots of things, but nowhere more interestingly lately than the role of patients and the capacity of patients to co-produce and be involved in their own care in meaningful ways. So I've asked Maureen to talk about patients' role in patient safety and quality. Jose Colucci is Senior Director and Associate Partner at IDEO in Boston, where he's been working since 2000. You just heard a conversation about what displays should look like, about alarm fatigue, I've been an advocate of EMRs for 20 years. For my sins, I now have to work with one. These are issues of design philosophy, design thinking. Human factors is the term of art, and that's Jose's specialty, and I've asked him to talk a little bit about the influence of design on the systems, techniques, processes, and things that relate to patient safety and quality. And lastly, Farzad Mostashari. Farzad, as many of you know, was a former head of National Coordinator for Healthcare IT. He's now the CEO and co-founder of Aledade, which is a company that aims to help primary care doctors transform their practices and form accountable care organizations. Now, Farzad, before he came to ONC, did similar work in working with primary care practices in New York City. And if you remember Judy Bigby's slide going back to Carl White about what a tiny proportion of actual care gets delivered in inpatient, high volume, high intensity quaternary teaching hospitals, and yet that's where most of the conversation, in fact, most of our conversation today has been about safety and quality. I've asked Farzad to share some thoughts about how the increasing availability of data in the outpatient setting can help us get a better handle on safety and quality in outpatient care. So with that introduction, I've asked each of my colleagues here to speak briefly. We should have a few minutes for questions and answers, and then as you know, as Ken has kept reminding you, we'll have time for a big group question and answer when this panel is over. Without further ado, Marie.